Hi, my name is Karen Grathwell, and the public health topic I chose to do my presentation on is the aging population and how it affects healthcare. So the baby boomer generation refers to the Americans born between 1946 and 1964. They make up about 77 million of the United States population, or about 24.3%. These people were born during the post-war period, and it may have been from the cause for wanting to have normalcy after many years of war and the Great Depression. And as of 2011, the first of the baby boomer generations are turning 65. They use a large portion of our national budget on medical spending, and this is going to become an increasing problem in a few years, and it is already. So the effects of the aging population on healthcare. First of all, acute illnesses were switched to more chronic diseases, such as Alzheimer's disease, dementia, heart disease, osteoporosis. There's going to be an increased shortage of healthcare workers. There will be more needs for nurses, paraprofessionals, nurse aides to take care of the elderly population. And healthcare services will need to learn to deal with disability and elderly, and they'll need more places to take care of them, such as nursing homes and centers. And as far as Medicare, which covers people age 65 and plus for health insurance, this enrollment has doubled, and by 2029, it is predicted that 2.1 workers were needed to support each retiree, as opposed to 2.9 in past years. Possible solutions to the aging population and their toll on healthcare is Medigap, which is an insurance policy that helps pay for costs that Medicare does not cover. There's also medical rationing, such as denial of procedures, and this would mean that expensive life-prolonging technology will be refused to those past a certain age. And this becomes controversial because it is unfair to deny people quality of life ethically. And to terminally ill patients, it can be seen as just prolonging their suffering and using the medical fundings that younger, healthier people with more potential to survive could be using. And there's also end-of-life discussions where patients and families should discuss how to live out the rest of their days. The aforementioned solutions are also controversial because denying health services to elderly and terminally ill people can be seen as ethically wrong. It's morally wrong to deny people a quality of life despite their situation. And there's also the issue of granny dumping, in which families abandon someone with Alzheimer's, for example, because they are unable to take care of them, to take care of someone who's too dependent. And there was a 2009 debate about a proposal that gave Medicare reimbursement to doctors who provided end-of-life care counseling. And this was controversial because people accused Obama of advocating for these death panels, as if doctors were telling patients that it was their time to go instead of providing the care to them. For the solution to this problem is, well, first of all, there's hope for the baby boomer generation because they are more educated than previous generations, and higher education is connected with greater health. The increasing age group could also have a reduction in chronic health and public health risk factors by not smoking, reducing dietary fat intake, by exercising more in their younger years and older years as well, and by taking other public health safety measures to ensure their safety for the future. And just individual responsibility about their own healthcare. Education services and programs could be provided as well, and this could help solve the problem. And yes.